Hello class, my name is Joshua Rivers. I am a second semester sophomore at George Mason University. Of the three final project prompts, I chose to do the history of psychiatric treatments and modality details. The psychiatric treatment that I decided to work on is psychodynamic psychotherapy. In this presentation, I would describe what psychodynamic psychotherapy is. I would then discuss the historical background behind this therapy, its evolution and changes, the clinical application, the relevance to psychopathology, the critique and controversies, the future direction of this therapy, and I will include a detailed infographic. First, it is essential to delineate the fundamental principles of psychodynamic psychotherapy. A study conducted by David Keeley and John O, published in the journal Contemporary Psychodynamic Psychotherapy, indicates that psychodynamic psychotherapy ranks among the most prevalent forms of psychotherapy currently in practice. It is utilized across diverse settings and contexts, catering to a broad spectrum of patients and clinical issues, and it is employed by professionals from various mental health disciplines. This therapy represents a systematic approach that involves an in-depth examination of an individual's cognitive process, relational dynamics, and wider socio-cultural context, all aimed at comprehensively understanding and resolving intricate life challenges. After examining the description of psychodynamic psychotherapy, we can shift our focus to a brief summary of its historical context and significant contributions made by its founder Sigmund Freud. A clinical psychology text published by Richard and Huppridge examines the idea that Freud's psychoanalysis constitutes the foundational theory of psychodynamics. Nonetheless, it can be argued that psychodynamic psychotherapies represent techniques for assisting individuals which are influenced by the ideas of Sigmund Freud. Previously addressing the historical context of psychodynamic psychotherapy, including its origins and key figures who have shaped its development, we will now examine its evolution and transformations throughout the years. A book titled Brief Interventions and Brief Therapies for Substance Abuse discusses it in its seventh chapter, published by the Substance Abuse and Mental Health Services Administration, that psychodynamic therapy is recognized as the oldest among contemporary therapeutic approaches. This framework is grounded in a sophisticated and intricate theory of human development and interaction. This book indicates that various approaches to brief psychodynamic psychotherapy have emerged from the psychoanalytic theory and have been clinically implemented across a diverse array of psychological disorders. In the following section of this presentation, we will delve into the clinical application. According to the article from the Substance Abuse and Mental Health Services Administration, and I quote, "The psychodynamic therapy focuses on unconscious processes as they are manifested in the client's present behavior. The goals of psychodynamic therapy are client self-awareness and understanding of the influence of past on present behavior. In its brief form, a psychodynamic approach enables the client to examine unresolved conflicts and symptoms that arise from past issues." End quote. This therapeutic approach is utilized in clinical settings to address a diverse array of mental health concerns, encompassing depression, anxiety, eating disorders, interpersonal challenges, personality disorders, substance use disorders, and post-traumatic stress disorder. We will now examine the relevance of psychodynamic psychotherapy to psychopathology. At the beginning of this presentation, we addressed the description of psychodynamic psychotherapy. Now we are going to look at the definition of psychopathology. The American Psychological Association's Dictionary of Psychology defines psychopathology as the scientific study of mental disorders encompassing their theoretical foundations, causes, development, symptom profiles, diagnostic criteria, and therapeutic approaches. The second description characterizes psychopathology as the behavioral or cognitive expressions of these disorders. This term is occasionally regarded as synonymous with the concept of mental disorder itself. Psychodynamic psychotherapy offers an intensive framework for comprehending the intricate interactions of unconscious processes, formative experiences, and defensive mechanisms in emergence and persistence of psychopathology. Let us now engage in a discussion concerning a critique of this therapy. which has emerged as a complex and challenging topic. An article discussing the challenges faced by psychodynamic counseling, published by the British Association for Counselors and Psychotherapy, emphasizes that the concept of the unconscious has always been fundamental to psychodynamic practice. This includes the essential notions of defense mechanisms, transference, and countertransference. The most formidable critique has arguably been directed toward the concept of the unconscious and its various components. In the absence of an unconscious conflict, defenses and therapists' trained ability to recognize and interpret these mechanisms, the psychoanalytic tradition essentially ceased to exist. In my opinion, despite the legitimate critiques regarding this scientific foundation of psychodynamic psychotherapy, this approach still provides significant insight into human behavior and psychological distress, particularly when integrated with other evidence-based techniques. Lastly, we will now address the future trajectory of psychodynamic psychotherapy. An article by Cortina M., titled "The Future of Psychodynamic Psychotherapy," discusses the substantial progress made in creating methods and tools that systematically investigate the intricate nature of psychodynamic treatment process. Statistical tools, including meta-analytic studies, are increasingly demonstrating the effectiveness of dynamic psychotherapies when compared to other treatment modalities by aggregating and analyzing multiple studies simultaneously. In conclusion, despite the challenges and critiques encountered by psychodynamic psychotherapy, its future seems optimistic, solidified by advancements in research, technology, and interdisciplinary collaboration. The objective of these advancements is to enhance the evidence-based nature of psychodynamic therapy, ensuring it is more accessible and adaptable to contemporary mental health requirements. To conclude this presentation, we have explored the concepts of psychodynamic psychotherapy, delving into its historical context, evolution, and modifications over time. We have examined its clinical applications, its significance in relation to psychopathology, as well as the critiques and controversy surrounding it. Finally, we have considered the potential future directions for this therapeutic approach. This presentation illustrates that while this psychotherapy may be among the oldest still in practice, its value remains significant, and ongoing enhancements will ensure its efficacy in addressing mental disorders. Again, my name is Joshua Rivers, and I appreciate your eagerness to learn about and comprehend the intricacies of psychodynamic psychotherapy. Goodbye.